You have joint pain and that limits your life. You've been told that little or nothing can be done. Moving away from sports and a sedentary lifestyle has not only failed to solve the problem, but is adding others to your life. Given that this sad situation is very common, today we delve into a little discussed topic: how to optimize your joint health. You will learn how your cartilage works and, more importantly, what you can do for yourself to strengthen them, reduce joint pain, and continue with your life. Cartilage is a specialized connective tissue with a key function: to facilitate cushioned and pain-free movement by covering the joint surface. Biological pads that ensure smooth movement. Since they are not seen and not felt, we usually forget they exist only until their wear starts to cause some problems. Given our movement pattern and load distribution, the most impacted cartilages are those in the hip, femorostabular joint, knee, tibiofemoral joint, and ankles. The shoulder is also a target of frequent injuries, but for other reasons such as its great natural mobility. What primary issues lead to articular cartilage decay? There are many, but we will highlight the following three. Osteoarthritis is a progressive degeneration of articular cartilage causing pain in the impacted joint. It is the most common cause of joint pain and is one of the leading causes of disability worldwide. Also, rheumatoid arthritis, a systemic autoimmune disease that affects the joints, progressively deteriorating them, or overuse injuries typical in runners, which occur after many years of accumulated repetitive movements with joint impact. This ties in with a controversial topic: is exercise beneficial or harmful to my cartilage? Traditionally, sports where frequent joint impact is generated and where there is a very uneven and constantly changing load distribution have been considered bad for the cartilage. Running, team sports with frequent and abrupt changes of direction, tennis, paddle. Indeed, they're typically the most popular and practiced sports. But should we keep people away from these sports? No, it's not appropriate to discourage people from sports activities in the present context. We can inform about more cartilage and joint-friendly activities. And we should advise to avoid risk factors such as excess adiposity. In addition to encouraging to strengthen the musculature as much as possible. Well, that's great, and even once a joint problem of sufficient magnitude has developed, we can temporarily advise to stay away from these activities, always leaving the possibility to return to them in the future, but also providing alternatives to maintain some physical activity. I repeat, professionals, never ever taking a person away from physical and sports activity is going to solve anything. Your cartilages have a unique limitation. Their ability to regenerate is extremely limited. Being an avascular tissue, they have little access to blood that provides nutrients and oxygen. Cartilage is avascular. That's why many orthopedists and textbooks will tell you that once deteriorated and degenerated, the cartilage has no room for improvement. In essence, damaged cartilage remains so indefinitely. But is this entirely accurate and useful or not? The answer to the first question is no. Despite being poorly vascularized, cartilage is a metabolically active tissue that contains living cells called chondrocytes. These cells, like any living cell, respond to certain stimuli. Stimuli that create anabolism or destroy catabolism, the extracellular matrix, collagen fibers, and other proteins that are in your cartilage. The framework in which the chondrocytes are wrapped. Obviously, it's not as plastic a tissue as muscle, but it can change. In fact, it does. And to the second question, consider how many people have adopted a sedentary lifestyle because their reference professional has forbidden them the sport they like, or worse, any sport, or has only allowed them a sport they do not enjoy, or are not willing to do, or do not have access to. Consider if this causes more harm than good, or vice versa. Humans are lazy by nature. If we don't have a justification to be sedentary, we invent one, but if our doctor gives it to us, then we don't even have to invent it. So let's get to the point. We can recover damaged cartilage even if it's partially. We can somehow prevent its damage without necessarily avoiding sports activities that we enjoy and benefit us. Let's see, the cornerstone of cartilage strengthening is paradoxically what many avoid: physical exercise. In fact, sedentary lifestyle accelerates cartilage deterioration. Yes, you heard right, exercise is good for cartilage, but only if you know which ones to do and which ones to avoid. Exercise in general reduces pain and improves functional capacity, but if we go to the micro, it improves the structural organization of the cartilage, increases the production of glucosaminoglycans, collagen, and other structural proteins. It also reduces the production of pro-inflammatory cytokines and enzymes called metalloproteinases that degrade the cartilage matrix. Wow! The correct exercise stimulates, protective factors of the cartilage and reduces factors that deteriorate it. But then what kind of exercise should I do? Which strengthens my cartilage and which should I prioritize? Pay attention. Cyclical movements without impact, with light impact of moderate intensity and resistance, and developed in short periods of no more than 10 to 15 minutes, also with sufficient recovery period between them. Listen to this as many times as you need. How do we put this into practice? Let's go back to the recommendation so that we remember cyclical repetitive movements of moderate intensity and resistance with null or low impact and with sufficient recovery periods. 5 points that qualify to comply with all these indications. Well, without a doubt, the most controlled and simple way to do it is with a cycle ergometer. Wow, a static bike that can be a traditional static bike, an air bike typical of CrossFit or functional training, or if also a bicycle to use, and an elliptical would also work for us. The cadence should be around 70 pedals per minute, and the resistance should be moderate at a subjective intensity of no more than 6 or 7 out of 10. The training would last a maximum of 15 minutes and would not be repeated before 6 hours of rest. That is, we would do a maximum of 2 sessions a day as the volume is low. We can do it daily, another alternative, I personally prefer an indoor rower such as the Concept 2 used in many CrossFit boxes. It's a more complete movement pattern that works muscles that we normally have inhibited and little worked, and that improves our posture. In this case, we would try to maintain a cadence of about 25 to 30 strokes per minute, which is not as easy as it seems. The resistance would also be left at 6, 7, but this can and should be complemented with other activities. The stronger the muscles near a joint, the more stability it will have and the less load the cartilage will have to bear. One of the best recommendations when our knee hurts is to strengthen the quadriceps muscles, but the same happens in the shoulder and other joints. The more muscle, the more stability and less pain. In fact, one of the best exercises to strengthen the knee cartilage is the leg press. With it, we are strengthening muscles and cartilages at the same time, with low impact and in a controlled manner. Try to do about 20-25 repetitions per minute with very little weight and stay at least 4 or 5 minutes. Yes, it's the toughest task, but it's done only once a day. You can combine these exercises. For example, on Monday you work on an air bike, on Tuesday on the rowing machine, on Wednesday you can do leg press at the gym, and you can repeat the cycle and keep combining. This way it will be more bearable, dynamic and fun. However, control what you do afterwards, because if you're trying to strengthen your cartilage but then you do 500 jump ropes, it's not going to be of much use. We need just the right amount of stress to achieve useful remodeling and to get results. Not less stress, but not more either. After several weeks of noticing pain improvement, you can increase your sessions. For instance, you can use a stationary bike before work and a rowing machine or press before dinner. And within strength training, there are more specific details that are worth knowing. Strength training is the top trigger for collagen production in joints. Since collagen is an expert at withstanding mechanical tension, in fact it's designed for that, when do you think your body will create more collagen? When you need to withstand more mechanical tension, and that's the challenge that strength training brings. But let's go a little bit further. Specifically, focusing on the eccentric phase of the exercise improves collagen synthesis even more, as this phase generates even more mechanical tension, breaking down old, weak, fragile collagen fibers and giving way to new, stronger collagen fibers. This is called improving collagen turnover or exchange. How to do it? Well, if we take the example of the leg press from before, we will slow down the movement when our knees are already bending and the weight returns to the starting position. This negative or downward phase, as it is commonly called, should last no less than 4 or 5 seconds. Then push the weight back in a controlled manner without fully extending the knee. And remember something important, although repetitive impact in general is not positive for your cartilage, it is for your bone, which strengthens with such impact. The impact generates a mechanical message in the mesenchymal stem cells that differentiate into bone cells and not into fat cells thanks to it. Therefore, if you are free of pain, healthy, strong, functional, including exercises with some impact is good for you to jump, run up and down stairs, of course it is good. As long as you control the volume and recovery times, this should not compromise your cartilage in the future. Another very different thing is to be untrained and start running 62 miles a week, sleeping 6 hours and carrying a suboptimal diet. you understand the difference. And what I mean right now, if you already have joint pain and the cartilage is to blame, first focus for a while on strengthening your cartilage with the cyclic exercises without impact and at moderate intensity that we have discussed in this video. In about 6 to 8 weeks of serious and committed work, you should see a noticeable improvement. That's when very slowly you could start to include some controlled joint impact. And of course, there are more serious and irreversible cases that require complex medical and surgical interventions, which of course are not the objective of this video. Now you have more tools to strengthen your cartilage and free yourself from the annoying joint pain. Remember, a sedentary lifestyle isn't a permanent solution. And if joint health interests you, in another video we will discuss supplements for your cartilage, the impact of drugs, and current and upcoming medical therapies. Thanks for your attention. I urge you to subscribe to our free mailing list here. See you in the next video. A big hug and keep empowering.